Hey there, we've got a pretty intense case study today.
Oh, yeah, it's a real nail biter.
So we're putting on our medical detective hats and diving into the ER notes and lab results for a 60-year-old woman who came in with some pretty alarming symptoms.
Definitely alarming. This one's a real race against time. Every minute counts with a case like this.
Okay, so let's get into it.
Yeah.
The patient presented with decreased urine output and swelling in both legs.
Okay.
And she said she's been dealing with this for about 3 days.
Uh-huh.
Now, on top of that, she has a history of diabetes and hypertension.
Right. So right away, those symptoms, especially the decreased urine output, that really raises concerns about her kidneys, how well they're functioning.
Yeah, and to make matters even more complicated, she's currently on medication for both of those conditions. She's taking metformin,
Okay.
and allopril, and NPH insulin.
Okay. Yeah, those medications are important to note because they can definitely influence what's happening and how we approach treatment.
Definitely. Okay, so let's jump into those lab results because things get really interesting here. Her creatinine level is 3.2 mg/dl. Now, I know creatinine is something that healthy kidneys filter out, but can you remind me what exactly this number means and why it's significant?
Sure. So creatinine is basically a waste product. It's something that healthy kidneys filter out of the bloodstream. But when your kidneys aren't working properly, creatinine starts to build up. And that's what we're seeing here
Okay.
with this elevated creatinine level and those symptoms she came in with that's pointing towards acute kidney injury or AKI.
AKI. Okay, so that sounds serious, and I have a feeling it's not the only problem we're dealing with here.
You are correct. Unfortunately, her potassium level is also extremely high. It's at 6.5 milliQL.
Wow.
And this condition is called hyperkalemia. It's a major red flag. Potassium plays a vital role in how our muscles contract, especially the heart.
Okay, her heart. So that's why they immediately ordered an ECG.
Exactly. And the ECG showed peaked T waves,
Okay.
which is a classic sign of hyperkalemia. These peaked T waves are telling us that the heart's electrical activity is being disrupted.
Oh, wow.
And that is very dangerous because it can lead to arrhythmias, some of which can be fatal.
So we've got acute kidney injury and dangerously high potassium.
Uh-huh.
Anything else stand out from the labs?
Yes. Her sodium level was also elevated at 154 MEQL, which indicates hypernatremia.
Okay.
This could be related to dehydration or a problem with the kidney's ability to regulate sodium, but we'll need more information to really understand the full picture there.
Okay, so we've got a lot to consider here.
We do.
Given everything we know so far, what's the absolute first priority in a situation like this?
With these lab results and that ECG showing peaked T waves, the absolute priority is stabilizing her heart. We need to counteract those effects of that excess potassium before it causes any serious problems.
Yeah, because like you said, it can be fatal.
Absolutely. It's a critical situation. And we need to act fast to protect her heart while we figure out what's causing all these imbalances.
So how do they do that? How do you stabilize the heart when someone comes in with such high potassium?
The immediate step would be to administer 10 milliliters of 10% calcium gluconate.
Calcium gluconate. Now that sounds familiar. Isn't that sometimes used for like severe allergic reactions?
Yeah, you're right. It does have a few different uses, but in this case, it's specifically for protecting the heart. Calcium gluconate doesn't actually lower the potassium levels. Think of it more as like a shield for the heart muscle.
Okay.
It counteracts those effects of the hyperkalemia and allows the heart to beat normally.
So it buys them some time, essentially.
Exactly.
Okay,
Yeah.
that makes sense. But while that's happening, they still need to figure out how to address those high potassium and creatinine levels right.
Of course. Stabilizing the heart is the immediate priority, but the medical team would simultaneously be trying to understand what caused this acute kidney injury. And that's where her medication history comes in.
Right, you're talking about the metformin and allopril and the insulin. I'm guessing those aren't helping this situation?
Well, they could be contributing to the problem, especially with her kidneys already being in a weakened state.
Okay. I know these are all pretty common medications.
Mm-hmm.
Can you walk me through how each one might be playing a role in this case?
Sure. Let's start with the enalapril. It's an ACE inhibitor, which is commonly prescribed for hypertension. And while it is effective at lowering blood pressure, ACE inhibitors can impact how the body handles potassium.
So that could be why her potassium levels are so high.
Exactly. ACE inhibitors can cause potassium to build up, especially in patients who already have impaired kidney function.
Interesting. Okay, what about the metformin? That's for her diabetes, right?
Yep, metformin helps regulate blood sugar levels, and it's generally very safe and effective, but it can be a problem for people with kidney issues.
What's the connection there?
Well, when the kidneys aren't filtering waste products effectively, metformin can accumulate in the bloodstream. And this can lead to something called lactic acidosis.
Lactic acidosis. I've heard that can be pretty serious.
It is. It can lead to a variety of complications, even coma or death. So in her case, with that acute kidney injury, the doctor would immediately stop both the enalapril and the metformin.
Okay.
It's just not safe to continue those medications right now.
So we're taking her off those two medications.
Yeah.
But what about the bigger picture? What are the long-term treatment options for someone in her situation with both the acute kidney injury and that life-threatening level of potassium?
The focus is going to be on two main things: managing that hyperkalemia and supporting kidney function, giving those kidneys a chance to recover.
And how do they go about doing that? I know you mentioned calcium gluconate to help stabilize her heart, but is there any way to actually remove that excess potassium from her system?
There are a few different approaches, but in a severe situation like this, hemodialysis might be necessary.
Hemodialysis. Now, isn't that something that's typically used for people with end-stage kidney failure?
It is, but it can also be a life-saving intervention in an acute situation like this one. Hemodialysis basically acts as an artificial kidney. It filters the blood and removes waste products, including that excess potassium.
So it gives her kidneys a chance to rest and heal.
Exactly.
Wow. It's incredible how quickly they have to make these decisions and how many different factors they're considering all at the same time.
It's a really complex situation, and the medical team has to carefully weigh the risks and benefits of every intervention. This case really highlights just how interconnected all the different body systems are,
Absolutely.
and how one problem can quickly cascade into another.
It really makes you realize just how delicate that balance is and how much we rely on all these intricate processes that are happening all the time without us even thinking about it.
It really is. And you know, it's a good point about all those processes that are happening behind the scenes. I mean, it's easy to take our health for granted.
Until something goes wrong, right? Like with this patient.
Exactly.
Okay, so we were talking about her medications,
Right.
the metformin, the enalapril, and the insulin, and how they could be playing a role in all of this.
Yeah, they could be part of the problem for sure, especially since her kidneys are already in a weakened state.
I know these are all pretty common medications. Can you break it down for me? How each one could be impacting her situation?
Sure. So let's start with enalapril. It's an ACE inhibitor, pretty commonly prescribed for high blood pressure.
Okay.
And it is effective for lowering blood pressure, but ACE inhibitors can affect how the body handles potassium.
So that could be contributing to those really high potassium levels.
It could. ACE inhibitors can cause potassium to build up in the body, especially if someone has impaired kidney function.
Okay, interesting. What about the metformin? That's for her diabetes, right?
Yeah, metformin helps regulate blood sugar. And it's generally a very safe and effective medication, but it can be problematic for people with kidney problems.
What kind of problems?
Well, if the kidneys aren't filtering properly, metformin can start to accumulate in the bloodstream, and that can lead to a condition called lactic acidosis.
Lactic acidosis. Okay, I've heard of that. That's pretty serious, right?
It is. You can have a variety of complications, even coma or death. So with her acute kidney injury, the doctor would stop both the enalapril and the metformin immediately.
Got it.
It's just not safe to continue them right now.
Okay, so we're stopping those medications. But what about the bigger picture? I mean, what are the long-term treatment options for someone in her situation with both the acute kidney injury and those dangerously high potassium levels?
Well, the focus is going to be on two things. First, managing that hyperkalemia, and then supporting kidney function.
Right, to give them a chance to recover.
Exactly.
How do they manage that? I know you mentioned the calcium gluconate to stabilize her heart in the short term, but is there any way to actually remove that excess potassium from her system?
There are a few ways to approach that, but in a severe case like this, they'd probably have to use hemodialysis.
Hemodialysis. Isn't that typically for people with end-stage kidney failure?
It is, but it can also be a life-saving intervention in an acute situation like this. It basically acts as an artificial kidney, filters the blood, and removes waste products, including that excess potassium.
So it's like giving her kidneys a break, a chance to kind of reset.
Exactly.
Wow, this is a lot. It's amazing how quickly they have to make these decisions.
Right.
And how many things they're considering all at the same time.
It's a complex situation, and the medical team has to carefully weigh the risks and benefits of every intervention. I think this case really shows us how interconnected everything is in the body.
Definitely.
And how one problem can lead to another, like a domino effect.
Yeah, and it's like you said earlier, it's so easy to take our health for granted until something like this happens.
Yeah.
It really does make you think.
Yeah.
And I think for someone outside the medical field, it's hard to really grasp just how urgent and how complex these situations can be.
It's true. The human body is amazing. It's this intricate machine. But when things start to go wrong, it can be like a real puzzle trying to figure out what's happening and how to fix it.
This case really highlights just how important those ER doctors and nurses are. They're like the first line of defense. They have to be ready for anything.
They do. They have to think fast, make quick decisions under pressure. They're like medical detectives.
Totally.
They have to put the pieces together using the symptoms, the patient's history, and of course the lab results. It's impressive.
It is. It's a huge responsibility, and it makes you appreciate all that expertise and dedication.
Absolutely.
So we covered a lot of ground today. Everything from the patient's initial symptoms and those scary lab results to the immediate steps they took to stabilize her. And to everyone listening, thanks for joining us for this deep dive into the world of emergency medicine. If you found this case interesting, maybe a career as a medical detective is in your future. Until next time, keep learning, keep asking questions, and keep diving deep.